my name's Roseen Ross and I'm an occupational therapist working at Bellavista School. For today's presentation, we're going to look at what occupational therapy is and looking more at functional occupational therapy. A lot of times we look at occupational therapy from a sensory perspective, but today we're going to look at generally what is OT. When would you refer a child to an OT, and what would an occupational therapist do to assist a child with their function? So when we look at the word occupational therapy, we know that therapy refers to intervention or remediation when somebody has a difficulty. When you think of occupation and a child, it seems quite strange. They're not a lawyer or a doctor, but the occupation of a child really is to play, to be a student, and different things may be affecting the way that they function or carry out these occupations. And this is when an occupational therapist would be called on to assist with helping this child in their function. OT is a very client-centered profession, so we look at what is important for this child according to their age or what really matters to them and how could we assist them. Because they're a child, they're part of a system and we need to work very closely with parents, caregivers, educators, teachers, and it's often the teacher or the parent who will refer to the occupational therapist because they are seeing difficulty that a child is having in their functioning. From an OT perspective, we really promote health and well-being through occupation. If a child is not able to learn and to play, this affects their health, their self-esteem, their social and emotional well-being. So our primary goal is to enable the child to participate in the activities of daily living. And we will help to try and develop a child's skills, or we may have to modify the occupation that they have to do, or the environment that they found themselves to really support their participation in the occupation that they need to do, or what they're expected to perform. So we look at the person, we look at the child. What are their skills? What is their age? What should they be expected to do on a gross motor, a fine motor, a perceptual skill, an activity of daily living skill? What chores should they manage for their age? Where should they be in terms of a developmental level? And then we look at the environment. So we need to see, are there any factors within their environment that are hindering or promoting their functioning? And we need to look at their home environment, their play environment, both at home and at school, and within the classroom. And we look at their education, their learning, their academic, their play and their leisure, and their self-care. So those are the three areas that an occupational therapist will really look at and assess in detail: the person, the occupation, and the environment. So the child will be referred to OT when they are struggling to do the everyday tasks that they need to do. And they may be struggling because they have an underdeveloped skill and maybe they're having academic difficulties to perform at school. They're not being able to partake in certain leisure activities, particularly for children. That could be sports. They may be having difficulty playing. Why can't they navigate the play equipment at the school? Why can't they complete a puzzle or the different play activities that they're requiring to do? And why are they struggling getting dressed or washing their hands or brushing their teeth or eating and all their different activities of daily living? And the OT will help a child to get better at doing these tasks and in so doing improve their self-esteem. So we really look holistically in terms of a child's well-being on a physical, social, emotional well-being. And the earlier a child starts OT, the more effective it does tend to be. It's really important to know what is average child development. So we need to know at each age and stage, what should a child be doing at 6 months, a year, etc., as they enter their school-going years. And that's why assessment at school is so important. That's why it's so important to be informed as a parent. When should my child sit? When should they be walking? What is the leeway between they need to achieve a certain skill? And when we see that a child is struggling to acquire this skill or this ability, then we need to refer them to OT to see what is affecting their functioning.